I'm calling the meeting of the LaPorte County Board of Health, April 21st, 2020, to order. Welcome to our new members, Dr. Mark Nelson. Can we get Mark on? Hi there. And Dr. Georgetta Manning-Cox. And welcome to the board. Dr. Nelson, can you hear us?
I can hear you good. I've got intermittently, I'll turn my microphone on mute so somebody's going to
Okay, perfect. Julie, could we have the roll call, please?
Ms. Long? Here. Ms. Long? Here. Great. Mr. Sandy?
Here.
Dr. Dora?
Here.
Mrs. Arnold? Lauren? Great. Dr. Nelson?
Here.
Dr. Manning-Cox? Dr. Uhas?
Present.
Mr. Mollenauer?
Here.
Very good. Okay. Thank you.
Thank you very much. The next item on the agenda is the approval of the board minutes from our January 14th, 2020 meeting. Are there any comments or questions about the minutes from January of 2020? Any concerns?
I can't really hear you. Can you get closer to the mic?
Can you hear me now?
Better.
Well, I'm pretty close. It's like an inch away. Pardon?
Go ahead.
All right. So are there any questions about the board meeting minutes from January 14th? If not, I will entertain a motion to accept the minutes.
I so move.
Is there a second?
I'll second that.
Thank you. All in favor?
Aye.
Aye. Any opposed? Hearing no opposition, the board meeting minutes from January 14th, 2020 are approved. Next, it is my pleasure to recognize the service of our former board member, Monique Thomas. Mr. Mancuso, did you want to say a few?
Yeah, sure. Monique, the health department, thank you for serving the board, and we appreciate all your input.
Thank you.
Thank you for your 8 years of service, and we have a little. So I'm going to read it to you. Then I'll put it over there at a safe social distance.
I can come grab it.
Well, yeah, I will. Let me just. This says, Monique Thomas, for your devotion to health promotion and disease prevention, your service will remain an invaluable contribution to the present and future generations of LaPorte County community. Thank you so much.
Thank you.
And best of luck to you. Here you go. Thanks.
Thank you.
All right. Next item on the agenda is public comment. Let me see if I can turn this. I just turned it off. Okay. Public comment. Do I see anyone that wants to make a public comment once? Public comment twice? Public comment 3 times. There is no one here to make a public comment today. Next, we have the health officer, Dr. Ducey. Can you kind of bring us up to, I know you've been very busy. Can you kind of bring us up to date to what's going on and what the health department has been doing?
The most recent numbers, I think we probably all watched those. Jenny may have something more. I didn't think everyone from today that there was 145 cases. 47 from the public, 77 from Westville, and 1 from INT. I think that may have changed since I got the last one, but bottom line is a fair number, although some counties obviously not near of that. What we've been doing is we're meeting with county commissioners and different kinds of things, trying to keep the line of communication open with regards to this. There have been some issues, and I think Jenny will talk more about contact tracing and things of that she and her team are doing an amazing job, I will say. We had to, at the request of student directors, we came up with a directive, and I think you probably all got a copy of it. And that's what to be in line with what's going on in those counties around it. There was also issues with the golf courses still, the social distancing, and they made changes and letters were sent to them, and we got letters back from all the talking about what their policies were and how they were maintaining regulations that were like that. I know we all know that we're closed county till May 1st at this point, and obviously we don't know future weather, so stay-at-home will be changed at that point. That's obviously going to be not a judgment from that Governor Hope, possibly. We have the biggest problem again here is everybody else listens to anybody anywhere but
Doctor, can you speak up a little bit? I lose you in and out a little bit. Okay. Yeah, thank you.
You and I were getting old. The testing is still insufficient, which is throughout the country. We're not unique in that way. Of course, that concerns us. Let's talk about opening up some of the things, but the ability to really test who is and who isn't positive, period. That's a concern. We really, at this point, these are the major issues. It's all COVID. The hospitals are still doing okay. They've got ventilator they've got rooms in their ICU. They have a very intricate surge plan that they have put into place of the previous we're still on stage 1 at this point. I think the biggest concern is what will come out of Westville, and I know that DOC is making plans to scatter the patients around as needed, not necessarily all into LaPorte and Franciscan. So that we'll see what need will come out of the jail. I think that's the main thing. Is people have questions. I mean, the bottom line is it's every day something changes in terms of numbers. Sometimes what's being recommended by different entities. But at this stage, the bottom line is we've not peaked, and we do expect more.
I couldn't hear the last. Could you just the last sentence, please? You said things change, but the bottom line is, and that's where I lost you.
You're breaking up for me too. I'm sorry. I can't hear what you're saying.
Okay. Is it any better now?
Yeah.
Okay. We lost the last sentence where you said the bottom line is
that it's a fluid situation,
oh, okay.
And we have not reached the peak in Indiana at this point. There's no real feeling that our curve has needed significant flattening move.
I got it. Okay. Anybody have any questions for Dr. Ducey? Any board
I
members?
have a couple of questions. One, I keep up with the Indiana State website regarding the numbers, and all of a sudden we had that jump by 90 that I assume was I understand was the Westville prison that had that big jump. When did they get their first guest there? When did they first test positive? That's my first question. Do you know?
Do you have the date? I don't have the exact date in front of me, no.
Yeah, Jenny can give you that answer right there. April 6th.
April 6th, okay. My other question is, when is there any plan, or do you know of any plan where people can get tested to find out if they have the antibodies already?
Nope. There's no plan yet. There's not the facilities, and there's not the, there's very little bit. I think Franciscan did 7 tests on Monday, and that was it. So it's just not available.
Okay. Thank you.
But just so I understand from what I've read, even if there are antibody tests are performed and somebody has antibodies, we still don't know if it confers immunity, if it confers short-term immunity or long-term immunity, and so there's still, and the value of it right now, we'd like to have it, but I don't think, this is all so new that almost every clinical aspect, including the pharmacology, is just still under investigation, and I think that's what I've seen.
The only place they're finding the antibody, doing the antibody testing is may or may not be happening. They're then getting plasma from these people and giving it to selected people in the ICU, but they still, even having done it, are not sure whether, in fact, it really is of any benefit at this point, but there's kind of a Hail Mary for some people.
I watched the ISDH video from April 17th today. It was excellent. And I was just wondering, one of the speakers on that video, the physician, it was excellent. He ran down the literature search recently on medications and so forth. But one of the things he mentioned was having one of those home pulse oximeters, because a lot of times people get hypoxic, aren't aware of it, or they need to monitor it. Some people are hypoxic, and anecdotal clinical observation, ER docs have said, we're seeing people sitting there with a PO2 of 50, and they're looking at their little phone. They don't even know they're hypoxic. So one of the things was to get a home pulse oximeter, especially for people that have COPD, older or high risk. That's my addition. And you can get those like at Walmart, probably CVS. Not that it's insignificant, but it's like only $50. And if it's something that can help monitor people for safety, it might be well worth it. I thought that was a good idea for folks that are...
Most of our COPD patients, especially if they have an admission to hospital, but we recommend them. There's quite a few out in the community at this time.
Okay. So I just want to mention the pulse oximeter idea. The other question I had, Doctor, if somebody tests positive, and I know this has been asked a lot all over the TV, but if someone tests positive and are asymptomatic, how long are they shedding a virus? Just because we're putting so much emphasis on testing and immunology, but and antibodies. But I just wonder, how safe is it to be around people that have gotten through it? Are they still infectious?
14 days. It depends what you read, but the recommendation is if somebody's positive, they should be quarantined for safety for 14 days. So you have to assume that they're shedding through that time. Okay.
Well, I just hope that's about the right, not much longer. That was my...
I think it's one of you said something earlier. That's one of the questions that honestly nobody knows. People are turning negative, now they're positive again. Was it really a negative test?
Right.
The medicine and the science is just so new for a lot of this that it's not really as hard. There's no really hard answers for a lot of these questions. This is just a 3-month-old thing, so it's absolutely still under investigation in almost every aspect. The thing about my other comment or question is about masks. I just want to make sure the N95 mask is protective for the wearer, and it's usually confined to healthcare providers. The masks that we talk about for the public, and even the cloth ones, that doesn't protect the wearer. That's for source control. In other words, the masks prevent us from contaminating others with a cough or a sneeze. So, I think sometimes people mistakenly believe if they're wearing a mask, they're safe from exposure. They're not. It's the other way around. They're helping the community to keep the virus from getting around, but they're protecting others. Is that correct? Yeah.
Okay. So that's called source control. The golf courses, are they still closed now, or
No.
they're open with these
Social distancing.
the social distancing and they're okay? Where are tests being done? Is it both hospitals?
Correct.
Yeah.
Okay.
But very limited. Very limited.
Right. Yeah. And one other basic question. Shoes. I've heard conflicting things about it from experts on the television. If you're out in public and you've been self-quarantining, but you had to go to the grocery store, and now you have no idea what's going on with the bottom of your shoes, what do you recommend, taking them off before you go in the house? And if so, how long would you leave them outside quarantined?
I've not seen any set recommendations for that or any real evidence that that is an issue, but I'm Canadian. We all take our shoes off before we go in the house, in everybody's house, so it's good practice.
So it's just a good idea, all things considered. That's great. All right. Does anybody else have any questions for Doctor? If not, we'll move along. Mr. Mancuso, can you fill us in on the health department and what's going on.
I want to speak for the health department. What we've done since the start of all this, of course, the health department had made some tough decisions, so we have suspended some services that we do in the health department. Basically, nurses, blood profiles suspended, immunization suspended, kids, everything's been suspended. Environmental, we're still doing. As you know, the restaurants are closed, but they still have the dine-in carry out, so we're still inspecting them, make sure they're in compliance with CDC recommendations. Amanda's got the labs open. I should let her talk about that with me. But moving on, but that's it we did as a department, so Jimmy and Amanda will give you a brief summary of what their section does. If you notice if you can see her, Danielle's our emergency preparedness. She was the nurse for us last year, and she retired. Well, not retired, she cared for kids, but. In the meantime, before that, in the department, I had another nurse that did our emergency preparedness for the county, for the health department, and unfortunately, the money I get for it's a grant. The money I get from the state is not very much. So as we moved forward, it turned into a full-time position. So I asked Danielle to come back in June, not knowing that this was going to happen. So now she was supposed to be part-time, now she's full-time. And basically, we're going to run out of money for her because it's a part-time salary. She's working full-time, but I got approval from the council last night to continue paying her to keep her. And basically what Danielle does is she's taking care of all the PPE equipment for us throughout the whole county. We're making sure that the health department has proper equipment. She takes care of the nursing home, and I'll let her talk a little bit more about it because she's expert at it. Danielle, are you there?
Yeah.
Okay.
Hello. Yeah, Tony said I came back on. Didn't expect to be thrown into a pandemic. So here we are. It's been a challenge, but it's great. We got a great team. We work a lot with getting PPE for the county, for offices. Our nurse practitioner and I have been tag teaming the long-term care facilities as well, making sure they have what they need. They're supported with guidelines from ISDH as they come out, making sure they're using the correct cleansers, just anything and everything in between. We work with all the first responders and getting them, making sure they're covered with PPE as well, EMA. We all have been working with some of the smaller healthcare entities as well, because sometimes, they have issues with their vendor hasn't been able to come through with what they have. We want to keep the virus at bay. So that's kind of what I've been working on. I've also been working on preparations in the event that we need a pod. If there is a vaccine that is deemed appropriate and works, or if there's an antidote or something that they come forward. So that's kind of what I've been working on a lot behind the scenes, making sure we have, volunteers, we have our locations secured down, but kind of all across the board, logistics, planning, working with the hospitals. It's kind of all across the board right now.
And to move forward on this, the equipment that we had equipment surplus from the 2009. We had the H1N1. Back in 2009, we were funded very heavily by the state. We had like 14 people working for us 10 years ago when H1N1 broke out. We had money supplies, and we had a lot of supplies that was in storage, and we were able to track it all down. We had some at the county garage, we had some in the maintenance building, so we all brought it back to the health department, and there was quite abundance. And Danielle was checking a couple of N95 masks if they were good, masks were good or not, because they're 10 years old. Some of them were, some of them weren't, but we still were able to give them out, and we just told them that, we're not guaranteeing these masks. So that supply is pretty well gone, but as the health department, like Danielle was saying, is we want to make sure that the health department is covered with our equipment if we do have to run a pod. So that's basically what we're concentrating. Also last night at the council meeting, in one of our budgets, communicable diseases, is that we have it's non-reverting, so all the money we make in that stays with the health department. So last night I asked the council if we could use that money for the COVID-19, and we were approved for that. So it's in our account. So we're going to use that money too, because I'm not relying on the state to give us money, but hopefully when this is all said and done, we can send them a bill basically of everything we bought. And hopefully that the FEMA will reimburse us on the equipment that we've used and what we gave away. So other than that, I can't really think of anything else. Any questions?
Danielle, I have a question. You said you may have to start a pod. Did I hear that? What's a pod?
That is a clinic. It'll be like we're doing now.
What does it stand for? It's an acronym. But...
You know what it stands for, Danielle?
It's actually point of dispensing.
Point of delivery?
Dispensing.
The what?
Point of dispensing.
Okay, because I know point of care, but this was a new one.
Yeah.
Thank you.
Any more questions? If not, Jenny and Amanda will let them know what they've been doing.
Yep. Nursing supervisor's report. Nurse Jennifer Smith, please.
Can you hear me okay?
Is your mic on? Okay.
Does everybody hear me okay?
Yes.
Okay.
Yes.
Not on.
So,
It's not on.
okay, try that. Is that better?
Yeah, you're on.
Okay. So Dr. Ducey was correct. We have 145 cases reported at this time, 47 from the public, 97 from Westville, and 1 from Indiana State Prison. So I'm just going to give you kind of an idea what a contact investigation looks like. When each case is reported, we do a thorough contact investigation, and we contact trace every contact that they've had close contact with from 2 days prior to symptom onset through the whole symptom period. Their contacts are considered close contacts if they spend more than 10 minutes with somebody closer than a 6 feet distance to them. So mainly it's like household contacts or very close work contacts that we follow up with. We provide all the contacts written education if they want that via email. If they don't want that, we go through the entire education piece with them on the phone. We've had pleasant experiences so far with all of our clients. They are very receptive, and they're very receptive to our instructions too, to how to protect themselves. The State Department of Health and the Correctional Health Services do the inmate investigations. But I do spot check those just to make sure they're being done and just to kind of get an idea what kind of problems the inmates may have had that would make them more susceptible to getting this. And most of them do have underlying medical conditions that make them more susceptible to being infected. Needless to say, it's a kind of a close congregate setting, so that doesn't help them either, but having the underlying conditions make it that much worse. So the statistics are updated on our county website daily. So anybody can go on our county website and look at the statistics. It's in graph format. It's broken down by age, city, race, and gender. So you can see what city they live in, their race, ethnicity, age, and gender. The state does update their website daily at 11 o'clock Central Standard Time. So you can go on and see the picture of Indiana and what the cases look like for the whole state of Indiana. The state has about 15 or more strike teams that go out to high-risk congregate settings for testing and infection control guidance, correctional facilities, long-term care facilities. And we just found out yesterday that the IU School of Public Health is doing some surveillance testing. So what that means is they're going to pick a random sample in each public health district, and they're going to invite people to be tested, whether they're symptomatic or not, to kind of get a picture of what the infection looks like in each public health district. So I don't know a whole lot about that, but I thought I'd mention it, that they're going to send out invites for people to participate, and it's voluntary. You don't have to participate if you don't choose to. But it's just something they're doing to try and get a better picture with the lack of testing that's available. If they do surveillance testing, that maybe they'll have a better picture of what the infection looks like throughout the state. If there's any hot spots or areas that need to be focused on. And that's... they have, if there's any questions.
Any questions for Jenny? I
I have
do.
a question.
Yeah.
Is the surveillance testing, is it an antibody test or is it a nose swab?
It's an NP swab, I believe.
This is a little bit aside, but I've heard experts on TV say, since it's not really possible to test the entire nation of 325 million people or the entire state of Indiana, that the preferable thing is to get random statistical samples, and then we have an idea in a region what the prevalence is. It's kind of infectious disease version of taking a poll, political poll.
Right.
You don't ask the entire nation who you're voting for. So I thought that made a lot of sense, because it seems like getting the testing, the swabs, the reagent, there are so many problems, difficulties, and then to multiply it by the population of a state or the nation. Do you think that's a little bit better way to get a handle on the prevalence of this
I do.
infection?
Especially, it's the IU School of Public Health, so they are experts in their field.
Yeah.
And that's what they do. So I trust that they know what they're doing and that this is the best for Indiana at this time.
Are they in any way interacting with us or giving us any of their data, preliminary data?
No, they just sent an email yesterday just to let us know they might be in our area in the near future doing some surveillance testing, and it's going to be voluntary. They're going to send out postcards, I guess, to invite people to do it. Now, I don't know how they're going to select their sample.
Yeah, it's got to be random.
It's random, yeah. So I don't know how they're going to select the sample, but they're going to mail voluntary, postcards, I assume.
Yeah, invitation.
Invitation to participate, and you don't have to do it if you don't want, they said, but it'll give them a better picture maybe of what's going on.
Right now, as it stands in our county, if somebody, I'm trying to get to testing here. You can't just walk in and say, I'd like to know if I'm positive. First of all, because that's meaningless. You could be negative today and walk out, and tomorrow you're positive.
Yes.
So healthcare workers and frontline EMS, those folks.
First responders.
Priority.
Yeah, priority.
Right.
Yeah.
And then, of course, someone comes to the hospital with symptoms. We need to know what's being admitted, what's being treated. So those folks get it.
Yes.
So there is no shortage then in India. Let me just say LaPorte County. For those groups that I just talked about, they are all getting tested as needed.
Right. And then they also say people that are advanced age with underlying health conditions they can be tested by the strike team. The strike team is set up in Gary right now.
Okay.
For first responders.
It's a high area.
And they have a problem with a lot of cases in Lake County. So, but they say if you're of advanced age or you have underlying health conditions and you show up to Gary to be tested, they're not going to turn you away. Morbid obesity is another thing that they're saying puts you at risk. So they will not turn you away.
But even if folks are positive, they're coming in that risk group, but they're not showing symptoms. Nothing would change other than they would go home and isolate.
You're supposed to be symptomatic, but I don't know if they're turning them away.
Well, I mean, the only benefit I could see of that would be to say you have to stay home and isolate from family, and that's useful.
Right.
I do have a question. I don't know if I'm asking you too many things, or Dr. Ducey would get this. There's screening and there's testing. And screening is the temperature checks, correct?
Yeah, I'm assuming,
like when I hear people say we're going to open up restaurants or workers are going to come back, we're going to screen them with or even at the airport, they're not getting COVID tests. They're getting screened, I believe, with temperature checks.
But there's limitations to that, too, because you can be an asymptomatic carrier.
That's where I'm going with this.
Yeah.
So the idea that, they'll say, well, we can open up if everybody I just heard that today. Everybody that comes into the restaurant gets their temperature checked. I I'm not sure. First of all, not everybody has a temperature in the early stage of COVID.
We've had a lot of cases that don't have a fever, an elevated temperature. We've had cases that do not have an elevated temperature. Yes.
Yeah.
At all.
The physiologic manifestations of COVID-19 are all over the place and affect multiple organ systems from the brain, the heart, the lungs, the kidneys, and now peripheral vascular problems and clotting problems and amputations. So it's so. I wasn't really paying attention to H1N1, but this one seems really different. The way we're responding.
Yeah, it's much worse than H1N1. I was here for H1N1, and it's much different.
Yeah, and there's even talk about this cytokine storm.
Yeah.
And there's two opposing thoughts on that in research. One is that's the problem. It's our own immune response that's making our symptoms worse. Others are saying, no, we need cytokines. They fight infection. And so same thing with fevers. Some people are saying treat the fevers. Others are saying, well, fevers are good. They help us immunologically to fight our own infections. I guess all I'm saying is I'm not saying that it's dismal or hopeless. I'm saying the opposite. I'm saying we need to be patient in society because there's just a lot that needs to be investigated, and this is really new. But there are experts and university centers and labs doing a lot of this investigation. Yeah. So we're on the road, but we just have to be patient.
Right, exactly.
And safe distancing works. Social distancing works. Yes. Other than, I just saw something before I came in. Somebody sneezed and it was 13 feet.
Wow.
Or a cough. So, it's not, that tells me that the message is, please wear a mask and think of your family, your neighbors, people in the community.
Right, yeah.
Dr. Dora, are you there?
Yes.
I have a question. Speaking of friends and community and coughing, pets, as a veterinarian, is there any concern about two things? Pets getting ill or pets harboring COVID and infecting humans? I'll limit it to dogs and cats.
There's been a lot of concern since the two tigers were shown to be positive, but the AVMA is still saying that there's no evidence yet that there's any transmission from pets to people.
Good.
So we still at this time feel it's a safe thing.
Do you think that it's wise for pet owners, because I understand with the two tigers, and then I read something about kittens can get ARDS. If you do test positive, to be very careful with your kitties to stay away from them and isolate from them too. Not so much dogs, canines, but cats.
I think this thinking still is right now that there's not pet to human transmission. So I don't think there's any evidence for that theory yet.
Yeah, that was human to pet. So okay, because so far pets are fine and we should protect them and love them, but they don't need to be.
That's what I get information from the AVMA. The emails they have been sending out in the last few days to the last week or two have been saying. So I think we're still safe on that at this point.
Great. Thank you very much. Anybody have any questions for Nurse Jennifer Smith? Okay. Thank you very much for your hard work on this. Really appreciate it. Amanda Lanyers, do you have any? From Environmental Health Food Supervisor.
Good afternoon.
Afternoon.
Yeah, so the last couple of months have been kind of a whirlwind, to say the least. Yeah. And March was the longest year ever, and April seems to be flying by. When all of this started, we really cut back giving environmental our services. Our laboratory is still open. We are the only drinking water laboratory in the county. So if anybody with a public drinking water supply, so any of the restaurants or any commercial facility that's on a well, and also we do a lot of testing for municipalities, IDEM is still requiring them to have all their bacteriological samples taken for their water. So some of them have to test monthly, some of them quarterly. So those are the reasons just we still need to keep our water laboratory open to be able to provide that service. We are not doing restaurant inspections currently. We're not going out and doing inspections, only on a complaint basis. And that is to keep that social distancing. We don't want to, these kitchens are extremely small, and to put another person into it we decided was not such a great idea right now. But those first couple of weeks of when the governor's orders came out was very intense with getting everybody under control. Not really under control, but letting them know what they could and could not do with the curbside pickup, with no dine-in options. We had the most problems with a lot of the bars where that have restaurants that were doing carry out. We'll come in and we'll have a beer while we're waiting for you to make our sandwich. And obviously that was not the intent of the governor's order, and had to be, he made that very clear later on in an update order, and got Alcohol Tobacco Commission the power to go in and say, if you're not doing this, we're going to pull your liquor license. So that's been a lot better, but they still have been checking in. We've been driving around, especially in the outlying areas, the smaller communities, to make sure everybody's in compliance with those orders. The more densely populated areas, they get busted out pretty quickly. You have a lot of people around, and so we're getting complaints about that, and we're able to take care of it rather quickly. The septics are still busy. Again, we can't have, especially with repair systems, we can't have failed septic systems all over a place, because that's still a public health concern. So we're still very busy in septics.
They can still pump and haul, obviously.
Yeah, you can pump and haul.
I was worried about my septic, and I was thinking, oh boy.
Oh, absolutely. Yeah, no, that's an essential service.
Yes.
Yeah, they can pump and haul. That you can have your pumps tanked, or your pumps tanked, your tanks pumped. I just was talking to one of the septic installers and pumpers yesterday, and she's like, we've been getting calls like crazy to come pump, because now everybody's at home and they're getting a lot more use than what they normally do. With all the kids are home, and then parents are working from home. So yeah, they've been very busy with that. We're not putting a lot of emphasis on or priority on new construction, but we've told them that we'll still get to you, but it's going to be a little bit, there's a lot going on. We'll get to you as soon as we can. Obviously, the failed septic systems are a priority to get those installed and inspected. And of course, we can go out and do those inspections, and there's nobody on site, so we don't have to worry about having the contact with people. We've working with Danielle to coordinate donations. We put out a press release, was it just last week, looking for donations from the community. If they had extra masks or gloves, everything you can't be had. We had been getting people asking if they could donate, so we went and put out that request, or that public release. So we are working on coordinating those donations, bringing them in, and then getting them back out to the community, the people, the areas that are in need. Dr. Cora asked for, after the contact tracing is done by the nurses,
follow-up.
He wanted a follow-up to the 14-day follow-up. So we are assisting with that, calling up and doing that, the follow-up questionnaires, and we're ready to step in whenever nursing needs us to also help with that contact tracing original questionnaire. So restaurants and bars, obviously, were closed. They've closed down, and came through that all the swimming pools had to be closed. As hotels are still an essential service, if somebody's traveling or they have to be quarantined, or it's not safe for them to be home.
Public swimming pools.
public and semi-public swimming pool. So if a swimming pool in your backyard, you can swim in your own swimming pool,
Okay.
but you can't go to a hotel or the YMCA
Right.
or pay like at any of the country clubs. All of those, it's closed.
Not that we have beaches, but because it's all underwater.
Yeah.
But in the event that we ever do, I know Michigan City closed Washington Park.
Mm-hmm.
What about? But there are parts along the lake that still have a little beach.
Mhm.
Those are closed, or are they?
We
So,
don't
'cause
control weather-wise. The weather is going to keep that closed for now.
Well,
yeah.
We've been asking the mayors of each, the mayor of LaPorte and all that, to really, because they're the ones who, like Pine Lake, the swim areas there, it would be up to the city to.
Because I was thinking like Stop 30 is what I was thinking of, where there's a little, sometimes there's a little strip of sand, weather's going to be nice.
Mhm.
There are ways to get down there and find a little bit of sand.
Yeah.
25, I think, is another.
Mhm.
But there's no official policy on Lake Michigan, Long Beach beaches.
Not at this time now.
Okay.
Mhm.
Okay. Because I think it'll be coming if we ever warm up.
Yeah, it will be,
We
but
will-
it's going to be depending on what the governor's orders when he starts opening things back up, and yeah, I don't know who's going to police those beaches.
Probably local
It would have to be a
local PD,
yeah,
I would think.
yeah.
I have a question about the carryouts.
Mhm.
I am a little conflicted. I know, like, one of the pizza companies that are on TV say, we guarantee we'll make the pizza, we don't touch it. You know, and I understand that. I believe it. They put it in a box, and they can deliver it outside. You can phone it, your credit card, or however you want to pay for it without any contact. But, what's the situation with the boxes or the bags that they deliver the food in? Is there any reason to be concerned that those are kind of contaminated?
Not really. If they're following all of their normal safety procedures, just with the handling the food, it really shouldn't be a concern.
Okay, so if I order a pizza, which I'm thinking of, the box should be okay.
Yes.
I don't need to leave it out for 2 weeks.
No, you don't need to leave it out for two.
Cool a little
Right.
bit.
No.
It's so much better when it's warm.
Yeah. Exactly. Who wants cold soggy pizza? So today on the governor, on his daily address, he was talking about the restaurants and about getting them back opened, and wanted everybody to start thinking about that, how they were going to manage their restaurants. He didn't say when that was going to happen, other than he was looking at to happen in May. So it could,
Yeah, so we're waiting for
4 or 5
guidance.
weeks there for him to say, okay, we can start opening on a limited basis to dine-in customers. So,
All right.
anybody have
Anybody
any
have
questions?
Any questions? Mike, nothing? Anyone? Thank you very much for your work on this, and I appreciate it.
Yeah, no problem.
All right. So we accept all the reports.
One more comment. As a department, what we did was basically I was thinking safety for the employees. Right now, we're on a rotating basis, so we have some staff working from home and some staff report to work. So not everybody's all in the office at once. So we try to keep our distance from each other. So that was a plan that us supervisors came up with, and we rotate the staff. Jenny rotates her nurses, and Amanda does hers. So it's working out pretty good. Everybody's doing a real good job. So our team's pretty good. I mean, I think we're doing a fine job.
Yeah, they're great work, and thank you very much for the work you're doing, and thank you very much for coming in today. I know you could have Zoomed, but I appreciate you guys coming in. I think we've covered all of the department heads right now, and I don't have anything on that. Attorney's report, we don't have anything, and Nelson is not.
Yeah, Nelson, are you there?
I am.
Okay,
Oh, you
yeah,
are. I can't see a little bit. Hi.
Hello. No, I don't have anything to report. I just want to congratulate all the board members for making this such an easy meeting. I've been in a lot of these Zoom meetings, and this is one of the smoothest ones that's been run. So that's a congratulations to all you all.
Yeah, this is going very well. The technology, we thank you guys.
Yes.
And I have my bunny slippers on under the table.
If Mike wants to say anything.
Mike?
Mike Mullenhour.
Yeah.
Mike.
Yes.
Do you have any? Yes?
Yes.
Yes, I do. I just want to congratulate all of you also. And I agree with what Nelson said about Zoom meeting. One of the staff that attended, and I just want to thank and just let everybody know that Tony and his staff, all the health department officials, have really been communicating well with the county council and the county commissioners, keeping us up to date, and just great communications. And today's meeting not only was well organized, but very, very informative, and I hope a lot of public listen to it and take heed to everything. And just great job, and just good work.
Thank you, Mike, and I agree. I second that. Do we have any old business that I'm aware of? Nothing. And there's no new business other than what we've been talking about, which is ongoing. Oh, Amanda, do you have something?
Yep. Sorry, new business we do. We've got to put on the agenda.
Come on down.
So,
Me again. Thought you were all done with me. So quickly, we offer ServSafe testing 6 times a year. So every other month we do that. Every restaurant, every food facility has to have a ServSafe certified person. So it is and we offer that. We proctor the test every other month, twice a day, or one day we do a morning and an afternoon test. That certification is good for 5 years. And every restaurant by Indiana code has to have somebody on their staff with that. And we're one of the few health departments that actually provide that service. So we charge $40 for the test, to take the test. That's how much it costs to take the test with ServSafe. So we're proctoring that. We're not making any money on that. We proctor it. They come in, take the test. And the big thing is books. At one time, we had extra money one year. We bought a bunch of books so we could lend them out. People could borrow it, study, and turn the books back in. Well, imagine that books slowly disappeared. So then the next time it's like, all right, well, we're going to do this again because there's still a demand for books, that they'll have to prepay for their test. They'll have to pay. They want a book. They can come get a book for $40. When they come to take the test, bring us the book back, they don't have to pay us anything else for the test that day. So they were basically just prepaying for the test. Well, now those have slowly disappeared because $40 for a ServSafe book is a pretty good deal.
What is your cost for the book? The department's cost. So
the department's cost, we can buy the book with the text, the exam inside of it, and it's $55. So yeah, so if somebody prepaid for the book and they didn't bring them back, the thing is we don't have any more books. So what we're asking to do is to just sell the book, period. We can sell the book with the answer sheet inside of it for $60. And the next best price on Amazon I found today was $80.55. So when they're ready to take the exam, they can come back. They already have the answer sheet. They don't have to pay us anything else. And then for $20, they have a book. So we're asking to be able to do that.
How much did you want to?
$60 for the book and the test, and still keep the test just for $40 if they don't need the book.
Okay.
Well, I think that's reasonable.
Oh yeah. And the $40 also covers not just the test, but somebody. You said proctor. Is it in person or?
Yes, one of my staff, one of the food inspectors.
So that covers everything.
It
book
covers
and
everything.
Taking the test.
The test and the materials and the mailing. Yeah. And so then for $20, they have the test. They have the book. They can use it as reference, or they can sell it to a friend.
But you're charging $40 for the book.
No, we're
$40 for the test.
$40 for the test.
Okay.
Okay,
I got it.
Yeah, we used to let them have the book for $40, and when they brought it back, then they could take the test for nothing.
Yeah.
But now they've realized it's a lot cheaper just to...
Yeah. And the $40 covers your cost for the test?
Yes.
Okay, that's what I wanted to make sure.
Yes, yeah. We get a discount from the National Restaurant Association, or the Indiana Restaurant Association gives us a discount on the books and the test exam, so we get them for like $55. So we want to for.
Is that something you need the
60.
board to approve?
Yeah,
that?
I need
Yes.
approval for the board so I can take to the commissioners.
I move that we,
Well, does anybody have a question?
okay.
Anybody on the board have a question about that before we make a motion? If not, then let's go ahead and entertain.
Quick question.
Yeah.
When I was jail matron, I was also safe certified, and I did all mine online. Is that not available anymore?
To do the test online?
Yeah.
You have to go, you can't do it online. You have to go to a testing facility, and you can take it by computer at a testing facility. We don't have any of those locally. I think the closest one is Maryville.
Did that change? Because I remember taking my test online, and I was sent the certificate in the mail.
I don't know, there's a couple of different tests that you're able to do with ServSafe. We require the certified managers, which has to be a proctored exam.
Okay. Okay, I know at one time they weren't having to do that anymore, but I already had mine. So, and this was a long time ago, so maybe the rules changed.
Okay, any other questions about this change? And if not, is there a motion to accept the change?
I make a motion that we change it to $60.
Well, I want to sell the book for $60.
Yes.
With the
Sell
test
the book
exam.
with the test.
And that gives them the entrance into the test.
Yes.
Yeah. Is there a second?
I'll second that.
Thank you. All in favor?
Aye.
Anyone opposed? So moved.
Thank you.
Thank you.
5 minutes.
Yeah. Thank you. All right. I think that's it for old business, new business. The final item before we adjourn is our next meeting in July of 2020. And since today is the 21st, I was wondering, is earlier in July good for like the 14th? It's another Tuesday. Does that work for folks? When is the?
Could you set the date again?
Well, just a minute, Doctor. I was proposing the 14th, but they're saying the fair is on.
That would be, I think that's the week of fair.
Okay, all right. Yeah. How about the 28th? Is that too late in the month? No. Board members, how does the 28th of July sound?
Sounds great.
I think I'm out of town on the 28th and the 21st. We'll see if that goes through.
Okay. Anyone, is there a reason why we can't do it like on the 7th? I know there's no reason legally, but we're just so used to do it. Tony?
Do whatever you want to.
Could we move it up to like the beginning of the month in July? I know.
I would stay away from the first week.
You would stay away from the 7th?
I would.
Okay. All right. So, and Dr. Nelson was saying he may be gone on the 28th, but not certain. What you guys? What's good for folks toward the end of the month of July? The 29th? Does it have to be on a Tuesday? Because of the room? Yeah, I don't know if the room is. That's. All right, let's try this. How about Dr. Nelson? How about the 30th?
What day of the week is that?
That is a Thursday.
I believe I'm back on Thursday. I'm supposed to be taking a trip to the Pacific Northwest, getting back on the 29th. I don't know if that's going to even happen these days, but I should be back on the 30th.
All right, let's just float that one. Is there a conflict with? Because I really would like to see everyone here, and especially new members. How does the 30th of July work for everyone? Is that doable?
Now,
Sounds good.
Pardon?
I'll just have to go out work early.
All right, let me go in order. Dr. Ducey, does that work for you?
I'll just have to book out of work early. I work on Thursday afternoon.
I can make it work.
Okay. All right, Allie?
I'm flexible.
Dr. Dora?
Yes, that will work.
Okay. Well, who else am I seeing on that little screen that...
Lauren Arnold.
Who?
Lauren Arnold.
Mrs. Arnold. Okay. I'm trying to... All right, so the board members are good with that. Health department okay with that, or...
Whatever you say, we'll be there.
Pardon?
We'll be there.
Okay. Anybody else? Ms. Waldmauer, anybody? Okay, so right now it looks like July 30th, a Thursday, instead of a Tuesday. So would anybody like to maybe make a motion on that, since it's complicated? I can't make a motion.
I move that we do it July 30th.
Second?
I'll second that.
Okay, all in favor? Anyone opposed? The ayes have it. That's our next meeting. And with that, unless there's anything else anybody would like to add, we will adjourn. Thank you very much, everyone. Stay safe, stay healthy. Thank you to the health department.
Thank you.